Welcome to everyone to our OSAC Kuwait meeting. OSAC stands for Overseas Security Advisory Council. We are a small but very committed group of people who are working on keeping especially the American community safe in Kuwait, the American business community, helping corporations at work in Kuwait to keep their people safe. But of course, we cooperate with other nationalities, especially our Kuwaiti hosts. And we're very, very happy that we have an outstanding Kuwaiti speaker with us today. I'm Dana Winner. I'm the co-chair for the private sector. Brian Zartman is the Regional Security Officer acting and also the current co-chair for the public sector. And he's already mentioned that we have a couple of his team members from the Regional Security Office who are here with us on the meeting today. We have several of the steering committee members with us today. We have especially Bana Zizi, who is the person who put this meeting together. She is taking responsibility to help us with public health and healthcare safety and security, leading and guiding us and helping us to connect with the Kuwait healthcare community. And also we have Crystal Al-Shati and Joan Kaja, who are on the steering committee. A couple of our steering committee members have a conflict today and weren't able to join with us. They are Musaid Al-Najjar and Robin Ward. So thanks to everybody for being here, and thanks to the people who will be viewing the recording later. And we hope that you will get a lot of benefit from the presentation today, from the lecture of our dear special speaker. So I would like to, at the request of Dr. Bana, I would like to introduce our special speaker. Dr. Maitham Hussein is a highly qualified and highly revered medical professional and medical provider in Kuwait. He's a consultant in pediatric medicine, allergy, and clinical immunology, with a special interest in stem cell therapy. He is the current CEO, Chief Executive Officer, and Medical Director of Kuwait Association for Care of Children in Hospital and Beit Abdullah Children's Hospice. He's worked as a consultant at NBK Children's Hospital, which is a specialized center for childhood cancer and stem cell therapy. He did his residency at Children's Hospital McMaster University. He has a subspecialty in allergy, immunology, and stem cell therapy, which he practiced at the Hospital for Sick Children at the University of Toronto. One thing that I found very, very interesting and important in Dr. Maitham's background and current activities is that he's very, very much involved with accreditation and quality and standards in Kuwait for medical care and dental care. He's a director of accreditation and quality affairs for the Kuwait Institute for Medical Specialization. So he's overseeing KIMS, that organization is overseeing training and certification of medical and dental specialists in Kuwait, which I think we all are very happy to hear about and to learn more about. So we see that Dr. Hussein has many areas of expertise in quality improvement in the postgraduate education and training programs. So I would like to thank Dr. Maitham Hussein for being with us today. Welcome, Dr. Maitham, and we are very much looking forward to what you have to say to us today. I'll give the mic to you.
Thank you so much for your kind introduction. That is more than what I usually put on my short bio. One thing that you have not mentioned, and I wish to mention here that I don't like to be called doctor. I would like to be called by my first name. And this is to blame Dr. Banafsha Azizi for not mentioning that specifically. But thank you so much for the introduction. That had saved me a lot of time, because often I address the people by saying, what is the reason why they should listen to me? Because they do have their own area of expertise, and they do have their time that is very, very valuable. And in order for them to be convinced to listen to somebody, they should have a good background of why they should be listened for. And just to share with you that this August of 2022, I will be going into my 50th birthday, but also the 25th year of serving health system in Kuwait and elsewhere. And as Dana had outlined very, very nicely, that not only my interest is in providing clinical service, but also supporting the health system in Kuwait with its workforces, whether it's a medical workforces in terms of medical education, but also health system in terms of equality improvement and accreditations. And recently, or not recently, but almost a year from now, I was appointed as a director of planning and health development at the Ministry of Health, beside the other leadership position that I hold. One other learning experience and work that I do is I'm a surveyor with Accreditation Canada International. So not only that I've learned about health system in Kuwait, but because we serve hospitals and health facilities in the region, and the MENA region, Middle East, North Africa, and the European countries, there is a lot of learning that happens at the accreditation surveys from this health system. So I chose to speak to you today about what does the health system look like in Kuwait today, an area that I have learned myself working in the health system, but also managing accreditation, quality affairs, and planning, and working with many, many expertise, whether they are from Accreditation Canada or Royal College of Physician and Surgeon of Canada, or the WHO, whether it's the country office or the regional office or the headquarter, where and as well as with the London School of Economy, who have done comprehensive review of the health system in Kuwait in collaboration with Kuwait Foundation for Advancement of Science. This had taught us a lot about health system in Kuwait, whether you like it or dislike it, but this is what I will view as a reality. Before I dive into this, I'm not quite sure how much you know about the composition of Kuwait as a country. Currently, we work on a statistic of 4.6 million population, of which 1.2 millions are Kuwaiti citizen, and the remaining are made from citizen of many, many nationalities, European, African, American, North American, and from the Asian continent as well. So based on this, there is a very, very heterogeneous group of patients that the health system in Kuwait serves. Not only that, but different populations, whether they are citizen or non-citizen, they do have different health determinant, or what we call determinant of health. Their socioeconomic background is different. Their health issues are different. So whereas Kuwaiti populations or Kuwaiti citizens are relatively a young populations, because children less than 18 constitute almost a third of the population. Yet there is a growing number of the elderly. So this is going to be an issue for Kuwait, not today, but probably the future, something that health system in other countries have dealt with in the past 10 years or 20 years. Kuwait will face in the future. At the same time, if you look at the average age group of non-citizen, because they are the workforce, they are mostly the healthy folks in the age group of 25 to 45. Yes, there is a group who are more than 60, but the majority of the non-citizens are in this age group, and hence their health requirement is a bit different when it comes to a share. The other thing about the health system in Kuwait is that there is a mandate by the Kuwait constitutions that the government to provide a free health service and a free education for its citizen. And that was something that a lot of the citizen had lived with for many, many, many years, especially after the discovery of oil and the economic worth of the country. But also this was provided to the non-national, which is something that also the non-national, non-citizen had lived with for many, many years. At the same time, there was a growing number of a private sector, especially after 1990, because of the the type of medical services that need to be established. So beside the growing numbers of hospitals and health facility in the government side, there have been also a substantial number of private hospital had opened. And this had created kind of a competition between the public and the private. The public being funded by the government, and the private, it's mostly by out-of-pocket money that comes from the citizen and few insurance. Over the last few years, the government had invested in kind of a share of insurance to a group of citizens, and that is the retired citizen, and the non-citizen. They use the general insurance to provide them a basic medical health care in the government hospital, but also a private insurance through the private sector. So if you ask me, where is Kuwait now? Kuwait is in the middle of a major transition based on the change of health demand globally, based on the diversity of the medical need between different age group and different sectors, but also based on the pandemic that we all faced, with the availability of the vaccines and medications and drugs and competition. So at this stage, the Ministry of Health, which is the government arm of health, controls everything related to health, from the fact that they regulate and license the health sector, they provide healthcare services, and they purchase healthcare services through their budget. So in a way, this is something that is different than other countries, where the government is mostly a regulator of the health sector, and the service provider are either a private sector or a teaching hospitals or other non-profit organization. And then there is the purchasers, which is usually the insurance, whether it's a universal health coverage through government-funded insurance or a private insurance, or a mix of both, with a basic package from the publicly funded insurance and the private insurance. So currently, the Ministry of Health and Health Sector and the government are in a major revision of this. What is going to be the role of the Ministry of Health in the future? Many experts had advised the Ministry of Health and the government of Kuwait that the Ministry of Health should be a sole regulator, licensure body, as well as a quality assurance body, which is mostly the function of a government in a developed world. So now comes the question of then who is going to provide the service? And there is a lot of discussion about that. The private sector is expanding. They are building more hospital with more beds, substantial number of clinics and specialized clinic, mostly in the area of what the population need, such as the chronic diseases. An example is being diabetes or the cardiac surgeries and the CABG surgeries, as well as plastic surgery, dermatology, and other services. And then you have a group of what I would call the marginalized populations that they feel themselves shared between the public and the private, and they could constitute also a large share of the populations. And I don't know how much you are familiar with the social structure of Kuwait, but Kuwaitis do have large houses and homes, and each house in a home, they do have housemate or workers with drivers or cook and whatsoever. So this number of house mate and workers constitute relatively around 200,000 from the 4.6 population. So that's a substantial number. And here is where a let's say, creative solution had came where a public and private partnership solution came under the name of Daman. And if you Google Daman, it's a kind of a publicly funded and a privately funded insurance scheme that look after this group of the workers in the household, at the same time provide a primary and secondary care to them, especially that they are in the range of age group of 20 and 35 and 40, and they do not require a very expensive medical services such as the cardiac surgery or the cardiac catheterizations or cancer treatment or other treatment, but they do require the ongoing medical check, mostly the acute illnesses that they get, whether it's a pneumonia or some medical illnesses. Also, the private sector in terms of company and commercial sector is expanding in the country, and most of the non-Kuwaitis are employer of the private sector. They are not employer of the public sector, and hence they do have different scheme of a private insurance that they enjoy. Those people who live in Kuwait have through their employee have seen different insurance scheme. So really, it's a very, very gray zone that Kuwait is going through, and where I do see opportunities for international organization, businesses, and countries to help Kuwait with is to, number one, help Kuwait to transition into the right model, because many countries, European, North American countries, have been through different models, and their insurance scheme have changed with time. Their government body control and governance and accreditations and so on have gone through many versions to the version that they are in right now. For example, in Canada, there is the provincial health coverage that provide a comprehensive medical care, and that is funded by the government of Canada. And then there is the private scheme of insurance that is available in the United States, plus the insurance that is provided to the military services. But also the business sector in the international world, including a group in the United States and Europe, can provide Kuwait with the service delivery model. And those who are familiar with the Kuwait society, they know that Kuwaitis are very passionate about traveling all over the world. So they have seen different health system. They know the good and they know the excellent and they know the bad and they know the average. So they are extremely difficult citizen to please when it comes to education and health. I'm sorry to say this, but when you measure their satisfaction rate related to health and education, you will see the satisfaction rate is not proportionate to the amount of money spent on health and education and the hospitals that is built. So again, providing the business model and the service delivery model that would balance the amount of money and human resources that is injected into the system versus the patient satisfaction. Having said that, because of this huge discrepancy between the resources that is injected into the system and the poor satisfaction rate, the government had invested heavily in a fund that support treatment abroad for its citizen. And sometimes, depending on the year that you look at the health finance of the Ministry of Health, sometimes this have taken around 15 to 20% of the Ministry of Health budget and other ministries such as Ministry of Health or Interior or the oil sector. Why they needed to do this? Again, because health system was becoming very expensive to fund and provide. At the same time, the satisfaction rate was low among the citizen. So then they said for pediatric cases, for genetic diseases, for cancer patients, for cardiac problems, there is the opportunity of a treatment abroad in different health centers in the United States. So you hear about patients going to MD Anderson, to Cincinnati Children, to Boston Children, to Cleveland, Mayo Clinic, and many other health center of excellence in the United States. This model is not sustainable, again, because as I alluded earlier, Kuwaiti population will grow in age, and hence chronic diseases, complex medical care will become a very highly on demand, as well as the elderly and geriatric care is needed. Cancer treatment is becoming extremely advanced, yet very expensive, and need a collaboration with many specialists, and boarding a patient or a family abroad might not provide the best care possible for that patient or the continuity of care. And hence, there is a lot of opportunity for this center to open their door to the international world and start their business in Kuwait. Again, whether it's for the 4.6 million populations or for other people who could be visiting from neighboring countries such as Iran, Iraq, Syria, Jordan, Saudi Arabia, and other countries as a hub. There have been some successful example in UAE with some of the international center that I will not mention a name just because of the conflict of interest and so on. So really, we are in, and the system is in a very heavy transition, and instead of experimenting which model of governance for health system should be applied, which insurance model should be applied, what service delivery should be applied. I think the Kuwait system would benefit from other countries' experience, whether it's a public, as a government, or a private sector, and what they have gone through. At the same time, there is a huge business opportunity when it comes to the business of health service delivery for cancer patient, for the elderly, for the geriatric, for home care programs, because these programs are in their infancy. So it's very, very easy to invest in. The reward in terms of business is higher because you do not have really a well-established competitor in the market when it comes to geriatric care or elderly or home care or cardiac programs and so on. At the same time, acknowledging the fact that Kuwait is a small country. And in order to develop expertise, this might not be feasible just on working on the number of patients in Kuwait and so on. And hence there is a huge room for investment when it comes to training doctor, nurses, allied health specialists and healthcare worker in centers in the United States and other countries. Again, looking at the healthcare workforces, there is a huge discrepancy between the nationals of this sector. For example, taking one example only, and that is nursing. Almost 85% of the nursing sector in the country is run by the non-national from India, Philippines, and elsewhere, which basically, when we faced the pandemic and there was a competition among many countries over healthcare workers, including nurses, because of the need, the system somehow was shaken with the fact that many of these nurses had left to the United Kingdom, United States, and other countries for, let's say, a better job opportunity, or maybe social opportunities or family opportunities. So there is a lot of room for even investing in medical education. Kuwait only does have one medical school that does have the capacity to graduate 100 physicians per year, whereas the rest are sent abroad for education for undergrad to the UK, US, Egypt, Jordan, Saudi Arabia, Bahrain, and other countries. There is not only the physician, but also there is only one institute to train nurses, and there is no faculty or college that train special diploma nurses for specialized procedures such as a tracheostomy and so on. And the third workforce investment that is an opportunity as well is basically in the area of hospital management and leadership. Because again, from my CV, you have read that I do have a lot of clinical degrees and clinical background, and I should be a practicing physician or a clinician, but I was forced to go into leadership position based on the fact that there wasn't a lot of investment in healthcare leadership training, and mostly is a physician or a clinician who are trained through their practice to become a leader. So this is an overview of the situation. Of course, consultatory organization would need it for the change management that's going to happen, taking the government of Kuwait and the Ministry of Health and the health system from a sole provider, funder, and regulatory to three sectors of regulation by the government: service provider, maybe private, maybe public, maybe combination of both, and then the insurance scheme or the universal health coverage for citizen and non-citizen. So I hope that I've given you enough information, but I also left some areas for you to inquire and ask questions if needed.
Yes, great. Uh, I'm going to take advantage and start the questioning right away. You mentioned, you were talking about the development of the private sector medical care, especially, I guess, the hospitals and clinics. You referred to especially after 1990. Could you elaborate on, are you referring to the occupation by Iraq as a turning point, and in what way, how did that create a turning point?
Yep, so thank you so much. Well, 1990 and 1991 is really a historic year to remember. But there is a lot of things that happened at the same time. The entire population scheme was disrupted at that time. So a lot of the non-Kuwaitis had to flee the country due to occupation. So Kuwait have lost a lot of the medical manpower because of this. And because it was almost an 8 month of occupation, these highly wanted academicians or professions had to find other opportunities in their life. So when Kuwait liberated by the international world and US, not many of the people who worked in Kuwait before 1990 rejoined. And that's because they find an opportunity for them to live, whether in the Western world or their own or countries. So there was a need to reestablish the services altogether. And because government was dealing with so many issues, and mostly security and rebuilding of the oil sector, the private sector had plenty of room to provide medical services. So we have seen a boom of hospitals that was built and a clinic that was built at the same time in the private sector, which did not exist before because the country was relatively a stable country in a very unstable region. But this was secured and provided by the government. Right after liberation, the government focus was on security, on rebuilding the oil sector, because that's the main source of economy for the region. This was a good opportunity for the private sector to take the lead. If you look at the number of private hospitals and private clinics, over the years, they have grown substantially. And not only health sector, if you look at the number of private schools and a private university, this had grown also substantially. Before 1990, I was a high school student. We had only maybe 5 private schools that were famous among students. Now there is more than 40 American-based or Canadian-based curriculum or a British-based curriculum in the health sector. Similarly, before 1990, there was only Kuwait University that was providing higher education. And now there is more than 10 private university that has a different scope and range of graduates that they graduate. And some of them have taken it up to provide special master programs as well. So I think this opportunity came because the government needed to focus on something, and there was a need of the population that cannot be filled so quickly by the government that was taken by the private sector. And those people who know Kuwait very well know that the private sector do much more better when it comes to operation than government. So it was easy for the private sector to recruit, was easy to the private sector to purchase quicker and provide the service much more faster.
Thank you. That's very clear. Other questions? Because I have several, but I don't want to dominate. So let's give other people a chance to ask questions.
I have a question. Maitham, again, my name is George Abuday. I'm the Chief of American Citizen Services at the Embassy, and my mission here in Kuwait is to provide American Citizen Services, passports, cribas, and information to American citizens in the country. I recently had the opportunity to attend a briefing by the staff, by the administration at the MAN, and learned a lot about their program. And it's I understand that they will pretty soon, it will be a requirement for all expatriates to register with the MAN and to pay an annual premium to receive coverage by the MAN. And I understand that they will roll out and make this and start coverage for everyone, for all expatriates within the next 18 months. I wanted to get your take on. It seems like a very ambitious timeline, and I wanted to get your take on the possibility of this happening and when it will be publicized more broadly, so that people know this is coming, and so that we can include it in our own messaging campaigns for Americans coming to Kuwait.
Okay, so the MAN was created as part of the public-private partnership projects. Many projects has been launched since then, and one of them was the health sector. And there is two major projects that was thought that
Sorry, Maitham, you've muted yourself.
Yeah, I didn't realize I was muted myself. So I was saying that the MAN is one of many projects that is under the umbrella of public-private partnership, the PPP, that the government had launched several years ago. And many other non-health project was kicking off extremely nicely. And there is one or two projects that was health related. One of them is the MAN that I will explore more, but also the other one was Jabir Al-Ahmed Hospital that was thought to be run by, owned by the government, Ministry of Health, but run by the private sectors in terms of operation. So the MAN was established to provide a health insurance basically for the non-citizen that is partially funded by the employee or the employers and partially funded by the government as well. So it's a kind of a mixed scheme of insurance between the public and the private. And the idea is, as I said earlier, is that it will coverage the non-citizen, which are mostly in the age group of 20 years to 45 years. Of course, they do have also families and children, but they are not the bulk that would receive the medical care that is needed. And because the primary and secondary care to this large number of the non-citizen was costing the government a lot, was thought that if this was outsourced to a business model that can run it at a lower cost and better operation and more efficient way, then that would save the government money, but also ensure quality. The question was raised all the time was, would they provide what we call a primary health care? So your regular checkup, the occasional infections that you get, secondary care, which is inpatient and so on. What about tertiary care? What about if you need a cardiac surgery? What about if you need cardiac cath? What about if you need a cancer surgery or high risk pregnancy? So I think there is a dialogue between the Ministry of Health and the MAN board about what is the scope of the medical services that they would provide and what is the programs that will be supported by the Ministry of Health. There is a general consensus that they would provide an insurance and they would provide a primary and secondary care. And hence they built the 2 hospitals and I believe so far 13 clinics that would provide the service to the client. And if the client needs at any stage a tertiary care, then they would be provided by the Ministry of Health. Would the MAN pay Ministry of Health, or is going to be a free service? That's again, it's area for discussion. How fast? Well, the MAN, as I said, it's a public-private partnership. So the private side of it is pushing extremely hard. They want to keep pushing to operate because they did invest into building the hospital. They did invest into hiring their leadership and staff and equipment. At the same time, Ministry of Health itself is going through its change, so this might slow down. My understanding is from the higher leadership of the country, there is a push for this project to move really fast and forward as soon as possible, at least in 2023.
Thank you, Maitham. I missed that last part. I apologize. What did you say about 2023?
So they are hoping to finalize those issues before 2023, so it can operate smoothly.
Okay, because I heard the timeline was much faster. Well, not much faster, but it's cutting it close. It seems very ambitious, but
But again, you have to understand that before these major things are resolved, neither the MAN would love to start, neither the Ministry of Health, before knowing if you get a very complex pregnancy, what do you do for it, right?
thank you so much.
Other questions? I'd like to ask one more.
Yes, Dana.
Oh,
Oops.
go ahead, Joan.
sorry.
Go ahead. Go ahead.
Yes, I'm representing the private schools in Kuwait, and I'm wanting to know, does mental health fall under your category when you speak about health?
Yes, absolutely. So mental health is one of the programs that I think will remain under the public freely funded services. Again, very similar to cancer. It has been endorsed by many organizations that mental health should be one of the programs that the Ministry of Health should continue to run. However, because again, mental health has to be very accessible to people, there was a move almost 5 or 6 years ago to allow more and more private clinic to open to serve the mental health issues that does not require hospitalizations or rehabilitation through the drug rehabilitation program. But this is not to replace the fact that this should be a publicly funded programs. So I don't see in the near future, 2 to 5 years, that the mental health would be privatized in terms of a program, rather ambulatory care and consultations and counseling rather than inpatients or specialized treatment or and so on.
Thank you so much. Yes, I mean, since COVID, I feel like that is an area that needs to be expanded or, like you said, easily accessed for the majority of, the population in Kuwait, and of course, students. Thank you.
Thank you, Joan. Maitham, I have quite a sort of big question. Years ago, I was a specialist in e-health with the National Institute of Health in US and was brought to Kuwait in 2000, well, the region in 2000 for the specific purpose of bringing this state-of-the-art e-health to the region. But what we actually found was it was too soon, and there was the cultural paradigm of the provider and physician-centric medical care, whereas e-health shifts a lot of the power towards the patient-centric healthcare. Where are we now on e-health? I know that's a big question, but if you can give some idea.
So being a director of a planning and also a medical educator, I sit in many committees. And then the issue with e-health, like anything, I think people always bring forward technology and products very early into the equation. And when they bring this, they realize that before you bring the technology and the equipment, you have to do your homework in terms of policy and a procedure and law and regulations. And I think 4 years ago, the Ministry of Health and other health sector had came to this realization that before there was a lot of interest in what health informatics system we should buy, what virtual tool we should buy, what robots we should buy for what services, cardiac or surgical or whatever. And they realize that these are physicians who are interested to do the procedure, yet nobody have developed the policies and procedures and the infrastructure for it. And I always used to say that before you bring the tool, develop the strategy. And that was missing, unfortunately. As you alluded earlier, bringing a e-health would shift the control from a practitioner to the patients and have the access to it, whereas the culture from both consumer as well as the provider, that there should be a health system service. So until this moment, there is a lot of patients who feel that they have not been provided a good health care if they don't get seen by a doctor in a hospital. So they see hospital as the gold standard of best practice of care, whereas now worldwide care should be provided where the citizens are, close to their home, close to their houses where they live, home care programs, and so on. So I think before investing into the e-health tools, equipment, and technology, there should be an infrastructure of laws, regulation, policy, quality control on this. And I think this had came to realization a bit late. Personally, and Dr. Bana can feed into this, we came as an organization, as a pediatric palliative care and psychosocial, when there was a pandemic and our children were at home. We needed to continue to provide our services to them. They were the high risk group to be missed in the midst of the pandemic. At the same time, they could hardly have access to their doctors because most of the hospitals were busy and actually dangerous to go to because they had a lot of COVID patients. And at the same time, as a non-for-profit organization, we can't close our door. So when we came to implement certain technology tools, we needed to develop, at least a first version of a policy that controls the interactions, the timing, what services that we could provide as a telehealth or using technology, and what other services. And this is what I see highly needed. And when I said that Kuwait had invested into sending clinician to a good healthcare facility, unfortunately, they have not invested in sending good leaders to the best healthcare management organization to deal with these issues, to deal with policy development, to deal with law reinforcement and quality management system. And this is where I see that the focus should be. Because again, you don't want to go and implement something and after 2 years, you find the data is being breached. There is no system for data confidentiality and security and so on. And most of the countries who have implemented those, they had the foundation, the infrastructure for it. So this was just on top. Very similar, we take the analog of a vaccine. You can't say that I want to produce vaccine tomorrow in Kuwait. There should be an infrastructure of research and academia and healthcare workers and raw material and a project that has already been synthesized to say, oh, now I'm going to produce a COVID vaccine. But you can't just come from the scratch and say tomorrow COVID vaccine is going to be produced in Kuwait, because again, there should be a law, products, exporting of raw material, protecting the healthcare workers and the human capital around it, and then market it as well because of the size of the populations. Because if you ask any company to come and open a vaccine a product in Kuwait and you tell them the population is 4.6, they say just forget about it. Probably their minimum is a 100 million dose per year, whatever. This is just one example of looking at the product but not looking at a strategy and a system. And I always use this as an example, although it's a very simple example, but it tells you how culture is very important. When I was a specialist practicing, there was one hospital that was, their medical record was based on papers. So doctors have to write their consult. And there was another hospital who were extremely proud of themselves that they do have an electronic health system. And I used to receive the consultations. The hospital that used to send a patient with a paper and doctors writing, usually they write every single details and the lab test and everything. and they have the proper questions. The hospital that has an electronic health record, they just fill in the spaces with any character that would allow them to hit submit. And I'm sure that, you know, the visa sections of the embassy, I've seen many of those applications that they fill it with junk so that they can reach to the page that says submit. And that tells you that, yes, there was a electronic health record, yet there was no policy, there was no procedure, and there was no quality check. That a blank of what is the reason for consultations and the clinical data were missing. It was just a comma that would allow them to go to the next field. That is the practice.
Yeah. Yeah. Any other questions?
But I should say that looking at how the public have used their mobile phone, there is no technology fear among the population. So there is this appetite because they use their phone in many applications. I think, and this is usually, not a usually, but it's one of the barrier for use is if the people are hesitant to use technology for that. But I see a lot of appetite for using mobile applications and technology on day to day by the people. You know, if you look at every single person, probably they do have one of those intelligent mobile technology in their hands.
Yes, right. Now we can hear from Zainab. She has her hand up.
Hello, everyone. Sorry, I don't have my camera on. I was driving, but thank you, Dr. Maitham, on the whole discussion and your insights and things. Probably from my perspective, because I don't look at a lot of what the health information systems are, what the plans are in Kuwait, and pardon my ignorance, I'm more on the tech side, but haven't looked at that ministry, to be honest. I was going to touch on the comment you just said about people are not afraid to use technologies. Yes, our digital gap is not as big as it was, but it doesn't mean it doesn't exist. And that brings us through to like the policy side of things on how do we build systems that we make sure that everybody can use and is user-friendly, has good customer experience and all of these types of things, which are embedded, I believe, also are in policy. So my question was, how far along do you think we are in terms of putting that base? What does it look like in the future? Are we even looking at the consumer side of things, the user side of things, as much as we should be while these policies are being put in place?
Yeah. So thank you so much, Zainab. I know that you are more of the content expert in that, and I'm not directly involved on those discussions, but I know that the Undersecretary and a team from the Kuwait University, Dr. Dari Al-Hwail and Dr. Iman Al-Ja'far were working together, and Dr. Salman Al-Sabah, about putting the infrastructure. And I know that the newly passed law by the government of the practice of medicine had endorsed using technology. So the law background is there. Now it's the policy and the procedure. Now, when we talk about user-friendly, there is a three categories of users. One is the patients and their family. Two is the doctors and the healthcare profession, and three is the Ministry of Health and the let's say the what we call central directorate when it comes to that. The pandemic have taught us that this is a need, and there is a pressure from the Council of Ministers as well as the Ministers of Health to push this agenda. So there is not only the public appetite, but also there is the socio-political environment is ready for that. And I know that the Prime Minister every now and then is acknowledging that the government should invest more in the e-technology and so on. So we are there. However, I should say, in the middle of defining yourself as a ministry, whether you are a regulator or a service provider or a quality assurance, is very, very hard to make a decision on, do we purchase this technology or not? Because you have to define who you are first. If the Ministry of Health have decided today that they're going to buy a Cerner as a health information technology, and Cerner is one of the best health information technology available, and then in 1 year they define themselves as a regulator, they will find themselves with a product that they will not use, and the healthcare provider will use, which could be the private sector or the and so on. So I believe that from the strategic point of view, we need to answer the first questions and implement the first phase of, let's say, disassembling the Ministry of Health to become a regulator, and then define who's the service provider and define who's the quality assurance before any expensive purchasing happens. And this is very, very important, because many people buy the product and then develop the policy, procedure, and quality around it, which is not the best practice. Rather, you have to define what is the strategy before you go and purchase. So that's one thing. The other thing is, because Ministry of Health now is the service provider, they feel ethically and professionally and politically that they should provide the same system to all hospitals, irrespective of their complexity or need, because it's a one body that should provide one product to all its hospital, because citizen and non-citizen will see, that they are provided with different products when they go to different places. So I think by defining who is the service provider, there might be a multiple service provider that would feel professionally and ethically okay with buying different product. And common example is, do you need the same health informatics system for the general hospital similar to the cancer center? Now, because it's one purchaser, they feel if they buy one for all, they will feel ethically and professionally okay. But then maybe when the service provider for cancer is totally different than the primary care, they might find a different solutions and a different product.
Would
Yeah, I
love
appreciate
to
that.
go further into that conversation, you, me, and Zainab. We could go quite deep into that conversation, right, Zainab?
Definitely looking forward to it.
Yeah. But I think we need to check with the other folks if there's any further questions before we close out the meeting. Okay. Well, there's somebody just coming into the room right now, so let me check who that is. Oh, Brian coming back into the room. I guess he left us for a few minutes. So let's check with him before we close the meeting.
No, Brian got dropped. Let's see if we can get him. He's having a connection problem.
Okay. Are you back, Brian? He's back.
Yeah, is my audio on here?
Yes.
Okay, yes, I'm back.
We're
Yeah,
just,
sorry, I just got bounced or went offline for some reason, so I just logged on a different device, so we should be good.
so we're just closing the meeting. Do you have any last words before we close the meeting?
Oh, Dan, I just wanted to thank yourself and Bana for putting this together, and especially thank Maitham for all his expertise. It was very insightful, and we appreciate him sharing his time and all his expertise on this tonight. So on behalf of the RSO office and OSAC with U.S. Embassy, thank you for everyone who contributed to this presentation tonight. That's all I have. Thank you.
Thank you, Brian. And Bana, do you have any wrap up for us?
Oh, no, just a big thank you to Dr. Maitham. I think he, my personal opinion is he's one of the best doctors in Kuwait, but he's also been an exceptional leader. And I do think he's going to be a trailblazer and make a huge impact in the Kuwaiti community of healthcare. And it's been a privilege working with him and learning from him. But thank you so much for sharing your insight today, Dr. Maitham, to a wider audience.
Yes, and this recording will be available for the people who had a conflict and were not able to be here. And I expect we'll see a lot of clicks on that link. I agree with you, Bana. This has been a very special meeting, a very honest and genuine and authentic presentation regarding the Kuwait health system. It could well be that we'll have some future conversations with Maitham. Thank you so much, Maitham, for sharing your time with us today. We're very grateful to you.
And thank you for giving me the opportunity to speak to this group. And I hope that, we have area for discussion. I always say that a good meeting is what leave you with a lot of questions to inquire about and follow up on.
Yes, great. Thank you so much. Okay, thanks to everyone and see you at our next meeting. Bye for now.
Hi, thank you very
Good
much,
night.
Lynn.
Thank you.